everyone. I welcome you all for Prof Buster Live Progenitor batch. So in this session of this batch, I am going to discuss a very important topic from pharmacology, the drugs acting on autonomic nervous system, that is ANS. We have already started this unit and we have already completed 4 out of the 4 chapters. 2 chapters are already completed. I mean cholinergic drugs and anticholinergic drugs are already completed. So now in this session, I'm going to start with adrenergic drugs. So let's start it. Let me share my screen with you. So here you can see my screen and I am going to start pharmacology, the drugs acting on pharmacology. So here, as I told you, there are 4 chapters we have to discuss. We have already discussed cholinergic drugs, anticholinergic drugs, and now here in this session, I'm starting with adrenergic drugs. So before understanding the adrenergic drugs and anti-adrenergic drugs, you must understand the sympathetic system of the autonomic nervous system. So as I told you, I always teach the drugs in a fixed set of heading. Okay, we have already covered cholinergic and anticholinergic drugs, and today we are going to cover adrenergic and anti-adrenergic drugs. And we cover the drugs in a fixed set of heading. So always, first of all, I'll let you know the introduction or the definition of that particular drug. Then I'll let you know the classification of that drugs. Then we understand the mechanism of action in the form of the flow charts, diagrams, and animations. Then we see the pharmacological action of that particular drug. Then we see the uses and adverse effect in the form of the master charts of that particular drug. And finally, the contraindication. So the same headings I will follow here also in adrenergic and anti-adrenergic drug. In anti-adrenergic drug, we have to understand 2 types of drug. We have to study 2 types of drug, the alpha blockers and beta blockers. But before understanding adrenergic and anti-adrenergic drug, you must understand the sympathetic system. So as I told you, autonomic nervous system is of 2 types. Parasympathetic system and sympathetic system. So you can understand in this diagram, all the nerves are motor nerves. What do you mean by motor nerves? Motor nerves are the nerves that carry the signal from the central nervous system to the organ. You can see this is central nervous system and these are organs. Look at the arrow. So these all nerves are carrying the signal from the central nervous system towards the effector organ. Look at the arrows. But they are of 2 types. What are the 2 types? Somatic nerves and autonomic nerves. So motor nerves, that is efferent nerves, are of 2 types. Motor nerves are efferent nerves and they are of 2 types. What are the 2 types? The 2 types is the somatic nerves and autonomic nerves. Okay, so what is the difference between them? The difference is the effector organ they are supplying. To which organ they are supplying? So if they are supplying to skeletal muscle, that is voluntary muscle, they are somatic nerves. That is somatic system. And if they are supplying to the involuntary muscle, that is smooth muscle, they are known as autonomic nerves or autonomic nervous system. So currently we are concerned with autonomic nervous system, that is involuntary muscles, that is smooth muscles. So these are the nerves which supply to smooth muscles or involuntary muscles. So that is autonomic nervous system. There is one more difference between somatic and autonomic we have already seen, but we are just revising here. So you can see somatic nerve is single neuron. Single neuron is there. Single nerve, single neuron, that is starting from CNS and directly ending in the effector organ. But in autonomic nervous system, there are 2 neurons. The first neuron, the second neuron. The first neuron, the second neuron. Whenever there are 2 neurons, there is a junction of the 2 neurons. The junction of the 2 neurons is known as ganglia. So in autonomic nervous system, we are having ganglia. In somatic nervous system, we don't have ganglia because it is a single neuron. But in autonomic nervous system, you can see in autonomic nervous system, we are having the ganglia here, we are having the ganglia here. Now, ganglia is never at the center. So you can see if the ganglia is towards the organ, you can see it is towards the effector organ. So the preganglionic fiber is longer and the postganglionic fiber is shorter. And this system is known as parasympathetic system or cholinergic system. The second possibility is that the ganglia, you can see here is the ganglia. The ganglia, here is the ganglia. The ganglia is towards the central nervous system, towards the spinal cord. It is not at the center. So when the ganglia is towards the spinal cord or towards the central nervous system, in this case, the preganglionic fiber is shorter and the postganglionic is longer. So this system is known as sympathetic nervous system. So autonomic nervous system is of 2 types based on the location of the ganglia. Where is the ganglia? The ganglia is towards the organ or the ganglia is towards the central nervous system. Ganglia is not at the center. So ganglia is the junction of the 2 neurons. So first of all, you understand what is autonomic nervous system. Autonomic nervous system is the nervous system that is supplying to involuntary muscles, that is smooth muscle. And it is of 2 types. Because in autonomic nervous system, there are 2 neurons, the preganglionic fibers and the postganglionic fibers. The junction of the 2 is known as ganglion. The location of the ganglion matters. If the ganglion is towards the organ, the preganglionic fiber is longer, the post is shorter, and that is that is parasympathetic system. And if the ganglion is towards the spinal cord, that is central nervous system, in this case the preganglionic is shorter and the post is longer, and this system is known as sympathetic nervous system. Currently we are concerned with sympathetic nervous system, but before moving on the drugs which are acting on sympathetic nervous system, you must understand the neurotransmitter of sympathetic nervous system. So what is the neurotransmitter of sympathetic nervous system? You can see in somatic system only one nerve is there, so only one neurotransmitter is required, that is acetylcholine at the level of the organ. But in autonomic nervous system, since there are two nerves, so two neurotransmitters is required, one at the level of the ganglia and other at the level of the organ. So what is the neurotransmitter here? At the level of the ganglia, it's always acetylcholine, whether it is sympathetic, whether it is parasympathetic. In sympathetic as well as parasympathetic, at the level of the ganglia, the neurotransmitter is always acetylcholine. But the neurotransmitter at the level of the organ differs. So at the level of the organ, in parasympathetic system, it is again acetylcholine. So in parasympathetic system, both the neurotransmitters are acetylcholine at the level of the ganglia as well as at the level of the organ. But in sympathetic system, at the level of the ganglia, it was acetylcholine. But at the level of the organ, it's noradrenaline. So noradrenaline is secreted out and it acts on its receptor over the organ. So here the main neurotransmitter in sympathetic system is noradrenaline. So before I move further, you must understand everything about the noradrenaline. Then only you can understand the drugs which are acting on sympathetic system. Okay, so in sympathetic system, that is adrenergic system, sympathetic system, the main neurotransmitter at the level of the organ is noradrenaline. So before I move further, you must know how does noradrenaline get synthesized, how it is stored, how it is released, and how reuptake take place. How does reuptake and metabolism take place? So let me tell you quickly. You can see this diagram. So I am talking about this nerve inside which noradrenaline is synthesized over here in the axon, in the exoplasm. And after that, once it is synthesized, it is stored there. When the impulse will come, at that time it is released out. Once it will be released out, it will act on its receptor, the alpha and the beta receptor, and show its action. Got it? So my point is that how it is synthesized inside this axon, inside this neuron, how it is synthesized and how it is stored, how it is released, and how after it's released it gets metabolized. So let me zoom this portion for you. So on the next page, can you see this diagram? This diagram is the zoom version of this only. So in this diagram, can you see this is the neuron? We are talking about this neuron. Listen. So let me highlight this neuron for you. You all can see I am talking about this neuron, the nerve ending. Okay, so this is shown like this here. So this is the same nerve ending. You can correlate here in this diagram. Okay, and you can see where is the organ over here. This is the organ. This is the organ. So noradrenaline is secreted from the neuron and act on the receptor on the organ. And this is the organ over here. Over the organ, appreciate alpha and beta receptor. So you can see noradrenaline is getting synthesized over here, getting released, and in this space, after coming in the space, it is acting on the receptors based on the organ, which are placed on the organ. So please imagine this diagram and understand how does noradrenaline get synthesized. So how does it is synthesized? The noradrenaline is synthesized from an amino acid. The name of the amino acid is phenylalanine. First of all, phenylalanine get converted into tyrosine in the liver. In the liver, this conversion takes place. Phenylalanine get converted to tyrosine in the liver. Once the tyrosine is formed, this tyrosine is uptake into the nerve ending. So this nerve ending is taking tyrosine inside it. This nerve ending is taking tyrosine. From where the tyrosine is coming? From phenylalanine. So first conversion, phenylalanine to tyrosine takes place in liver. Once the tyrosine is formed, it will be uptake. Into the nerve ending with the help of a transporter. The name of that transporter, you can see here, the name of that transporter, tyrosine transporter, is there. You can see this is a tyrosine transporter which is taking this uptake. So once the tyrosine go inside, this tyrosine converted first into dopa, then it will convert it into dopamine. The dopamine will enter inside the vesicle and dopamine get converted into noradrenaline inside the vesicle only. So the last conversion takes place inside the vesicle and noradrenaline will remain in the vesicle only. It will be stored in the vesicle. So this is what I'm talking about. Everyone here? So first of all, we need an amino acid. The name of that amino acid is phenylalanine. So this is phenylalanine. The phenylalanine get converted to tyrosine. Where does this conversion take place? This conversion takes place in the liver. Once the tyrosine is formed, it is uptake by the nerve ending, the axon. the exoplasm. Once it enters inside the cytoplasm, that is exoplasm of the axon, it will first convert it to dopa and then convert it to dopamine. These both conversion, dopa and dopamine, takes place in the cytoplasm of that axon, in the cytoplasm of that axon. The dopa once formed, it will enter inside the vesicle, and inside the vesicle it will get converted to noradrenaline, and it will remain there only inside the vesicle till the impulse come. You have to look the enzymes which are required at each step. At each step, the first conversion require an enzyme hydroxylase, that is phenylalanine hydroxylase. The second is also hydroxylase. It is tyrosine hydroxylase. But for the conversion of dopa to dopamine, we need decarboxylase enzyme. So it is dopa decarboxylase. And again, for the conversion of dopamine to noradrenaline, we require hydroxylase. So this is hydroxylase, this is hydroxylase, this is hydroxylase. Only this one is decarboxylase. You have to mind the enzyme. I will tell you the toxins which will inhibit the individual enzymes. Okay, so you have to learn this conversion. You have to learn the steps. How does it is synthesized inside the nerve ending? Ultimately, when noradrenaline is formed, it will remain as noradrenaline only inside the vesicle, but only in one organ. Which organ? Adrenal medulla. Inside the adrenal medulla, the noradrenaline will get converted into adrenaline. The last conversion takes place only in medulla, not in other organs. So how does the synthesis takes place? I will draw it for you. So you can see here I am drawing the nerve ending. This one is the nerve ending. And you can see this one is the organ. This one is the effector organ on which alpha and beta receptors are present. Okay. So first conversion. What is the first conversion? Phenylalanine to tyrosine. This conversion takes place in the liver. This conversion takes place in liver. Once the tyrosine is formed, it will enter in the exoplasm. So the tyrosine will enter in the exoplasm. First of all, tyrosine will convert into dopa and dopa will convert into dopamine. Okay. So these two conversions takes place here in the cytoplasm only, in the cytoplasm of this axon. Once the dopamine is formed, it will enter in the vesicle. This is the vesicle. Inside the vesicle, this dopamine will get converted into noradrenaline and noradrenaline will remain inside the vesicle only. Okay, that's it. This is the story. But if it is not a nerve ending, if it is the adrenal medulla, one more conversion take place. Noradrenaline get converted to adrenaline. But this happens only in medulla, not otherwise. Not otherwise. Now you have to learn the enzymes at each step. What are the enzymes at each step you have to learn? So here we require an enzyme hydroxylase. Here also we require hydroxylase. Here we require, this is the transport. Here also we require hydroxylase. Here we require decarboxylase. Here the name of enzyme is decarboxylase. That is converting dopa to dopamine. And again here we require hydroxylase. You are getting it. Ultimately noradrenaline is stored here. So this is how noradrenaline is synthesized in the nerve ending. You can see the enzymes. You can see the process. You can see the process. Now it will be stored here. When the impulse is coming, at that time, this vesicle, at that time what will happen? As soon as the impulse is coming, the membrane will get depolarized. You can see this membrane, axonal membrane will get depolarized. At that time, the calcium channels will open here. The calcium channels here will open. When the calcium channel will open, calcium influx will take place. Due to the depolarization, calcium channel will open. So calcium channel will open, calcium influx will take place. As soon as calcium will go in the exoplasm, in the cytoplasm, what does this calcium do? Calcium causes fusion of this vesicle with the axonal membrane. So you can see this vesicle will come and it will fuse with the axonal membrane. So the noradrenaline will come out. So noradrenaline will come in the space between the axon and the organ. In this space, first it is released. Once it will be there in this space, it will go and bind with the receptor and show its action, depending on organ to organ. Maybe the organ is having alpha receptor, beta receptor, both of them. Alpha is having two types, alpha 1, alpha 2. Beta is having three types, beta 1, beta 2, beta 3. So depending on the organ, which receptor is present. Whatever alpha subtype, whatever beta subtype, the receptor is present, noradrenaline will go bind with that receptor and show its particular action on that organ. Once the action is done, the action will be there for millisecond, for a fraction of second or for a millisecond. After that, we have to terminate the action. Okay, so you understand how does the noradrenaline get synthesized? How does it is stored? How does it is released? Now the finally, last thing I want to tell you here, how its action will be terminated. So how its action is terminated? If you remember in cholinergic system, how does acetylcholine get synthesized, stored and released? And how does the action of acetylcholine is terminated? The action of acetylcholine is terminated with the help of an enzyme, that is cholinesterase enzyme. But here it is not degraded. It is not hydrolyzed. There is no enzyme that will cause the degradation of noradrenaline. No, noradrenaline is not degraded. You can see this is the noradrenaline present over here in this space. Okay, we want to terminate the action. We want to terminate the action. So here the main mechanism via which the termination of action take place is reuptake. So this noradrenaline and this noradrenaline, which is acting on the receptor, after they have shown their action, the reuptake will take place in the exoplasm after a millisecond or a fraction of second. Once the action is done, so first noradrenaline is released, it will bind with the receptor, show its action. After a millisecond, its reuptake takes place. So reuptake takes place at two steps. First reuptake is inside the exoplasm, the first reuptake. And once it reaches in the exoplasm, the second reuptake is inside the vesicle. So two-step reuptake is required. Got it? So two transporters are required. For the first reuptake, there is a transporter. It is known as NET. Via NET, this reuptake takes place. Once it is in the exoplasm, the second reuptake takes place through VMAT. VMAT2 transporter. So the second transporter is VMAT. So ultimately it will reach inside the vesicle and get stored there. So maximum, the major portion of noradrenaline will get reuptake. Maybe 99% of this is reuptake. So this is how the action is terminated. Now, if you want to show again the same action, another impulse has to come. Another impulse will come and again the same sequence will be repeated. Again noradrenaline, again the depolarization will be taking place. Calcium channel will open. Calcium influx will take place. The vesicle will fuse. Noradrenaline will be released. That another new noradrenaline will bind with the receptor and show its action. Again, after a millisecond, its action is terminated because of reuptake. It will be reuptake. Okay, reuptaked. Okay, and this is how the action is terminated. I hope you understood this mechanism well. Okay, so you have to learn here two transporters, NET and VMET. So this is the complete mechanism. This is major route via which the action is terminated, 99%. But maybe a minor portion of noradrenaline enters in the blood. It enters in the blood. It is not reuptake and it is entered in the blood. Once it enters in the blood, it will be getting metabolized. This noradrenaline present in the blood will get metabolized. But that is a minor portion. That is a minor portion that will be going in the blood. That will go in the circulation. Major will be reuptake. The major will be reuptake. It is reuptake first in the exoplasm and then in the vesicle. The minor portion will come in the blood. Once it will come in the blood, it will be metabolized. It will be metabolized via two enzymes. What are the two enzymes? The first enzyme, COMT, and the second enzyme here, MAO. MAO and COMT. So MAO and COMT, it is not the sequence. Sometimes MAO at first followed by COMT. Sometimes COMT at first and followed by MAO. Ultimately, both enzymes act on noradrenaline and noradrenaline get converted into vinyl mandelic acid, VMA, and that is excreted in the urine. So this is the metabolism. I hope I explained you everything here, starting from the synthesis of noradrenaline, then storage of noradrenaline, then release, and then metabolism. Release, uptake, metabolism. So I guess you know everything now. How it is synthesized, how it is stored, how it is released, how it is reuptake, and once it go in the blood, how it is metabolized. The end product here is vinyl mandelic acid. No confusion. So same story is written. So everything is happening here at this junction we are talking about. So you can see the same diagram in front of you. I guess it's crystal clear to you. I guess the complete mechanism is crystal clear. So how the synthesis takes place, tell me. First of all, there is phenylalanine which get converted to tyrosine in the liver. You see this diagram. You see this diagram again. Okay. You see this flow chart. I have told you the enzymes also. You just see the slides now. So phenylalanine get converted to tyrosine in the liver. Tyrosine will enter in the exoplasm, that will first convert it to dopa, and this dopa converted into dopamine. This dopamine will enter in the vesicle. Okay, in the vesicle, this dopamine converted to noradrenaline remain there only. But if it is adrenal medulla, noradrenaline will get converted to adrenaline only in adrenal medulla. And you have to mind the enzymes at each step. Enzyme at all the steps are hydroxylase except dopa to dopamine conversion where it is decarboxylase. Rest all places it is hydroxylase, hydroxylase, hydroxylase. The last conversion, noradrenaline to adrenaline, it requires a methyl group transfer. So the last enzyme is methyl transferase. The last enzyme is methyltransferase, and you have to mind where does these reactions are taking place. Okay, so that is the thing. You get many MCQs over here. So what we learned that noradrenaline is synthesized in all neurons, but adrenaline is synthesized only in the adrenal medulla. The last conversion is taking place only in the medulla. How does the release takes place? So when the action potential is generated, I mean when the impulse is coming, at that time the calcium channels will open. At that time the calcium channels will open. The calcium influx will take place. When the calcium will go in the cytoplasm, what does it causes? Calcium causes fusion of vesicle with the axonal membrane. Fusion of vesicle with the axonal membrane. Once the vesicle fuses with the axonal membrane, noradrenaline released out. Noradrenaline released out. This is how release takes place. Once the release is there, okay, once the release is there, now we have to do the uptake. We have to do the reuptake. How does reuptake take place? I told you it takes place at 2 steps. Okay, first axonal reuptake, then vesicular reuptake. So once the noradrenaline is released, it will show its action on the alpha and beta receptor for a millisecond. After a millisecond, first of all, axonal reuptake take place. And then after that, once it reaches in the cytoplasm, the vesicular reuptake take place. Okay, this is major pathway. This is major pathway. This is major pathway. But a little bit of it enters in the blood. Enters in the blood and get metabolized. So that is known as extraneuronal uptake. It is uptake in the blood, not in the neuron. So first uptake is in the neuron and second uptake is in the blood. That is extraneuronal uptake. Okay, that is minor pathway. So first axonal uptake take place with the help of NET, with the help of a transporter NET. Can you see this is noradrenaline? Say yes. You can see this is noradrenaline. Can you see this is NET, NET transporter. So it is getting reuptake into the exoplasm via this transporter, NET. Okay, and this is the major pathway for causing termination of action. And this NET can be inhibited by a toxin, that is cocaine. Cocaine can inhibit it. You can see here it is written cocaine is inhibiting it. Cocaine can inhibit NET. Okay, the second reuptake is vesicular. Once after this reuptake, it reaches in the cytoplasm. Noradrenaline reaches in the exoplasm. The second reuptake is vesicular. It is through another transporter VMET. It is through VMET, VMET2, vesicular monoamine transporter, vesicular monoamine transporter, VMAT2. Okay, and here this one can be blocked by Reserpine. So you can see here is the Reserpine, and Reserpine can block this transporter VMAT. So NET can be blocked by cocaine and VMAT can be blocked by Reserpine. Okay, that is a second. And these two are the major pathways via which the action is terminated. But sometimes the action can be terminated by extraneuronal uptake, in which a little bit of noradrenaline can enter in the blood. It can enter in the blood via OCT and ENT transporter, that is organic cationic transporter or extraneuronal transporter. Via these transporter, it enters in the blood. Once it enters in the blood, it will get metabolized. It will metabolized by two enzymes, COMT and MAO. What is MAO? Monoamine oxidase. And what is COMT? What is the full form of COMT? Catechol O methyltransferase. Catechol O methyltransferase. So COMT and MAO are the enzymes which are acting on this noradrenaline once it enters in the blood. You can see MAO and COMT are acting. Ultimately, it will get converted to vinyl mandelic acid, which is excreted in the urine. I hope you got it completely. Yes or no? So you have to learn the toxins at various levels I was telling you. So you know the first conversion, phenylalanine to tyrosine, takes place in liver. This tyrosine enters in the neuron. Okay, so tyrosine get converted to dopa with the help of a hydroxylase. That hydroxylase can be inhibited by a toxin. The name of that toxin is metyrosine. Metyrosine can block this enzyme, can inhibit this enzyme, so block this conversion. Metyrosine is the name of the toxin, metyrosine. Okay, the second conversion from dopa to dopamine is formed. It is through another enzyme, that is dopa decarboxylase. This enzyme can be inhibited by carbidopa. This enzyme can be inhibited by carbidopa. You have to learn the name of the carbidopa. Once it is synthesized, dopa converted to dopamine, dopamine will enter in the vesicle, and in the vesicle it will convert it to noradrenaline. What will happen when the impulse come? When the impulse come, when the depolarization is taking place, impulse is coming, the calcium is entering, calcium influx is taking place, and calcium is fusing the vesicle with the axonal membrane. This fusion can be blocked by another toxin. The name of that toxin is guanethidine and beryllium. Okay, guanethidine and beryllium. These can block the release. Okay, so you have to learn which toxin is inhibiting what. Ultimately, noradrenaline come in this space, act on the alpha receptor, act on the beta receptor. The first uptake into the axonal uptake can be blocked by cocaine. Cocaine can block the first uptake. The first uptake, can you see this uptake? It can be blocked by cocaine, and the second uptake from the cytoplasm to the vesicle can be blocked by reserpine. So learn the 5 toxin. What metyrosine is blocking, what carbidopa is toxin. So metyrosine and carbidopa, they are blocking the synthesis of noradrenaline by blocking various enzymes. Okay, guanidine and bacterium, they are blocking the release. They are not blocking the synthesis. They are inhibiting or blocking the release of noradrenaline. And the remaining two, cocaine and reserpine, these are blocking the reuptake into the axon again. Cocaine is blocking the axonal reuptake and reserpine is blocking the vesicular reuptake. So please learn, you get many MCQs over here. So please learn the name of these 6 toxins: metyrosine, carbidopa, guanidine, bacterium, cocaine and reserpine. No confusion at all. I hope it's crystal clear. So can we compare now? In the last session, I taught you everything about the acetylcholine. In this session, I taught you everything about the noradrenaline. So can we compare the synthesis of both? Here I will discuss how does acetylcholine get synthesized, stored, released and metabolized or reuptake. Okay, I mean its action is terminated. And in this diagram, I will tell you how noradrenaline is synthesized, stored, released and how its action is terminated. So you can, in your mind, you can have a clear picture about the 2 neurotransmitters of the ANS. So this neurotransmitter is responsible for cholinergic system. That is cholinergic drugs and anticholinergic drug action based on this. Okay. And this neurotransmitter is responsible for sympathetic system. That is adrenergic and anti-adrenergic drugs based on this. So before you read the drugs, it should be crystal clear in your mind that how these neurotransmitters are functional, how they are synthesized, how they are stored, how they are released, how their action is terminated. And here we will do compare of both of them. So let's start it. How acetylcholine is synthesized? It is synthesized by amino acid choline. Choline enters in the cytoplasm. Choline. Once the choline enters in the cytoplasm, choline converted to acetylcholine. Okay, with the help of an enzyme, acetylcholine esterase. So this enzyme is converting the choline by donating an acetyl group. It is converting the choline to acetylcholine. Once the acetylcholine is formed, it will enter. After formation, it will enter in the vesicle. Mind my words. Once it is formed in the cytoplasm only, but after formation, it will enter in the vesicle and get stored in the vesicle. It will remain there only. Okay, got it? It will remain there only. But what about the noradrenaline? How does it get synthesized? So the first amino acid here is phenylalanine. Here the first amino acid was choline. Here the first amino acid is phenylalanine. Phenylalanine get converted to tyrosine. Okay, and this step takes place in liver. The first step takes place in liver. Once it is synthesized here, so this tyrosine in the liver, it will come in the blood and it will get uptake into the axon. This tyrosine will enter in the axon, in the cytoplasm of the axon. Tyrosine will first convert into dopa and dopa will then convert into dopamine. Once the dopamine is formed, this dopamine will enter in the vesicle. Please mind my words. This dopamine is entering in the vesicle and after entering in the vesicle, dopamine get converted to noradrenaline. So noradrenaline is synthesized in the vesicle. It is not synthesized in the cytoplasm like acetylcholine. Acetylcholine was synthesized in the cytoplasm. After synthesis, it is going to the vesicle. But here it is synthesized in the vesicle itself and gets stored. So you have seen the synthesis of both the neurotransmitter. Now release step is same in both of them. So when impulse is coming, here the membrane get depolarized, here the membrane get depolarized. So here calcium channels open, here also calcium channels open. Once the calcium channels are open, calcium influx takes place. Here also calcium influx. Once the calcium is in cytoplasm, what does the calcium causes? Fusion of the vesicle with the axonal membrane. So once the fusion occur, here acetylcholine is released out and here the noradrenaline released out. So release step is same via calcium influx. In both of them, it is via calcium influx. Once the neurotransmitter is in the space between the nerve and the organ, you can see the neurotransmitter is in that space. between the nerve and the organ. Now the neurotransmitter will go and bind with its receptor. For acetylcholine, we are having muscarinic and nicotinic receptor. For noradrenaline, we are having alpha and beta receptors. Okay, I guess everyone knows this. So acetylcholine will come and bind with muscarinic and nicotinic receptor and show its action. Noradrenaline will come and bind with alpha and beta receptor and show its action. It will show its action. Okay, whatever is the organ, based on that organ, the action is shown here. The action is shown here. Okay. Now, after a millisecond, they are showing their action. We have to terminate their action. That is important. How their action is terminated in the space between the neuron and the organ. We have to terminate the action. That is different. That is different. So in case of cholinergic system, we have an enzyme in this space. The name of that enzyme is acetylcholine esterase. Acetylcholine esterase. Okay, enzyme. This enzyme causes hydrolysis of acetylcholine. When this enzyme is causing hydrolysis of acetylcholine, so this acetylcholine is degraded and its action is terminated. It will get converted into acetyl separate, choline separate. Choline will be reutilized for forming another acetylcholine. So this is how the action is terminated. The termination of action is via degradation or hydrolysis of acetylcholine. The acetylcholine is degraded or hydrolyzed via an enzyme, that is choline esterase enzyme. Okay, choline esterase enzyme. Please learn the name of enzyme. But in case of adrenergic system, here degradation do not take place. Hydrolysis, degradation do not take place. What is the mechanism via which its action is terminated? It cannot act on these receptors forever. It will act only for a millisecond. After a millisecond, its reuptake take place. Its reuptake. First, axonal reuptake, and then once it enters in the cytoplasm, vesicular reuptake. Got it? So axonal reuptake is take place via a transporter, that is NET, and vesicular reuptake take place via another transporter, that is VMAT2. So please understand, this is the reuptake, the major pathway via which the termination of action take place. So in cholinergic system, for termination of action, enzyme is there that is degrading the neurotransmitter, that is acetylcholine. In adrenergic system, it is via reuptake of the neurotransmitter, reuptake into the cytoplasm and into the vesicle. Reuptake takes place of the noradrenaline. So please understand. So I guess it's crystal clear. And the most important thing, you must understand the toxin at both levels. In cholinergic system also, I told you 3 toxins. What are the 3 toxins? Hemicolinium, vasamicol, okay, and botulinum and tetanus toxin. You must understand at which step they are blocking. Here also I taught you 5 toxins. What were the toxins I taught you here in adrenergic system? The first toxin, that is mityrosine, block this conversion. Tyrosine to dopa conversion is blocked by mityrosine. Okay, the second conversion, dopa to dopamine, is blocked by another toxin. It is blocked by another toxin. So have a look on all the toxins here. Here I have shown you the 5 toxins. Just a second. Let me show you the 5 toxins again. Just a second. Where is that diagram? Yeah. So this is the mityrosine. The second is carbidopa. You can see here, let me write carbidopa. So this toxin is carbidopa, which is blocking the conversion of dopa to dopamine. Okay. Now the release can be blocked by guanidine, okay, and beryllium. Okay. These 2 toxins are blocking the release. And after that, the reuptake is blocked by cocaine. The axonal reuptake is blocked by the cocaine, and vesicular reuptake is blocked. Vesicular reuptake is blocked by another toxin, that is reserpine. Okay, so please learn the name of the toxin, and there also I taught you the toxin. So this is how you can compare and contrast the cholinergic system and the adrenergic system, the neurotransmitters of both of them. Now let's start the receptors of the adrenergic system. So in adrenergic system, we are having 2 receptors, alpha and beta. You can see alpha and beta. Alpha is of 2 types, alpha 1, alpha 2. You can see this is alpha 1, this is alpha 2. Beta is of 3 types, beta 1, beta 2, beta 3. You can see alpha is of 2 types and beta is of 3 types. Please appreciate the alpha and beta and see on which organs they are present. You can see alpha 1 is present on these organs, alpha 2 is present on these organs. This is beta 1, this is beta 2, this is beta 3. So you can see on which organs they are present and their corresponding action. But we will not learn this table. We will compile them and make the master chart. I call this table as master chart. So first of all, I will explain you this table. So on every organ, alpha and beta, most of the organ both are present, but on some organ only alpha, on some organ only beta is there. But you can see this is the table of combination of alpha and beta. This is alpha receptors, this is beta receptors, and these are the name of the organs. On which organ we have alpha, on which organ we have beta. And in the bracket, I have mentioned which alpha or which beta. So out of alpha, which alpha? Is it alpha 1 or alpha 2? Out of beta, which beta? Is it beta 1 or beta 2 or beta 3, like that? So in the bracket I have mentioned. So rather than learning this table that alpha is present on what, alpha 1 is on what, alpha 2 on what, alpha 3, you will get confused. So better to learn them in a combined manner like this, organ wise. So say the organ and we will see on what organ alpha is present, on what organ beta is present, and what is their function. One by one we will see. So one by one we will talk. We will quickly review this table and we will move on the drugs, that is adrenergic drugs. Okay, so let's start it. Can you see? First organ I'm talking about, the blood vessel. You have to learn this table. People, please understand. If you want the next 3 chapters, that is adrenergic drugs, in the anti-adrenergic drugs, alpha blocker and beta blocker, you want to understand these 3 chapters conceptually without mugging even a single word. You have to learn this table. You just learn this table. Only one thing you have to mug, this table. That's it. Apart from that, nothing you have to learn. I will explain everything. Adrenergic drug, alpha blocker, beta blocker, the uses, the adverse effects, the contraindication, the mechanism of action, the action in this table only. So this table, I will call this table as master table. This table is already provided on the app. Okay, on the app we have put the master chart for your last time revision. So you can revise these 3 chapters in just 5 minutes if you learn this table and you make the master chart. Master chart is already provided by me. So I will mark the uses and the adverse effect in this table only of all the drugs, of adrenergic also, alpha blocker also, beta blocker also. So please understand, this table is very important and you have to learn it. You have to learn it. So one by one we will talk about. So first of all, the first organ here is the blood vessel. Let's talk about blood vessel. On blood vessel, we are having alpha 1 and beta 2 receptor. Alpha 1, we have alpha also, beta also. From the alpha 1, alpha 2 both are there, but main is alpha 1. So alpha 1 receptors are there, and among the beta 2 are present. Okay, alpha 1 causes vasoconstriction, beta 2 causes vasodilation. Got it? So you can see this is the blood vessel. Vasoconstriction is caused by alpha 1 and vasodilation is caused by beta 2. So please understand, in a blood vessel we are having 3 layers: tunica, intima, media and externa. These are the 3 layers in a blood vessel. So in the media we are having the receptors. We are having alpha 1 receptor and we are having beta 2 receptor. Alpha and beta receptors in the media. Now please understand, when noradrenaline is coming, when noradrenaline is released here or here, the noradrenaline will bind with the alpha 1 also, it will bind with the beta 2 also. But with alpha 1, it will show vasoconstriction, and with beta 2, it will show vasodilation. Got my point? So both action. Now the what will be the effect on BP? So you know which drug is having which receptor action more prominent. Based on that, we will see whether vasoconstriction is a prominent effect or whether vasodilation is a prominent, and based on that, I will comment on the BP later on. It's very tricky. Please, I will help you in understanding, but please understand the basic. So what we have learned? We have learned in a blood vessel, there are 3 layers: tunica intima, tunica media and tunica externa. In the tunica media, we are having alpha 1 receptor and beta 2 receptor. Okay, both are adrenergic receptor. So they will bind with noradrenaline. When noradrenaline come and bind with them, okay, noradrenaline will come and bind with them. So what is the result? What does noradrenaline causes with alpha 1 receptor? It results in vasoconstriction of this blood vessel. Okay, and what does noradrenaline causes with beta 2 receptor? It results in vasodilation of this blood vessel. So please learn. Okay, you have to learn this basic. If you learn the basics, drugs will be super cool. You see, I will give much of the time in understanding the basics. Okay, once I start the drug, it will be like this. It will be very fast. Because you already know the basics, I have to just flip the pages of the master charts. And I have to mark the uses and adverse effect in this table only. Got it? Come back. So we have seen the effect of the alpha and beta receptor on the blood vessel. Now the next organ I'm talking about here is heart. Let's come on the heart. In the heart, we don't have alpha. We don't have alpha in the heart. We have only beta. Which beta? We have beta 1, not beta 2. In the blood vessel, we were having beta 2. Here we are having beta 1. Beta 1 is present only in 2 organs. Number 1, heart, and number 2, kidney. Rest all the places we have beta 2. Beta 3 is rare. It is present on adipose tissue and some other tissue. Beta 3 is rare. But beta 2 is present in maximum organ. Beta 1 is present only in 2 organs, the heart and the kidney. And their action is very important in maintaining the BP in human. Okay, so in the heart, we are having beta 1. So what happens when noradrenaline will come and bind with the beta 1 receptor present on the heart? So it stimulates the heart. It increases the rate, force and velocity. So in the heart also, we are having 3 layers. So this is heart. These are the 4 chambers of the heart. Right, And left side of the heart, you can appreciate the four chambers. So I'm interested in the left ventricle. Okay, I'm interested in the left ventricle. Here also we are having three layers: the endocardium, myocardium, and pericardium. Endo, myo, and peri. Okay, like the blood vessels, tunica, intima, media, and externa. Here also we are having the three layers: the endocardium, myocardium, and pericardium. I'm interested in myocardium. In the myocardium, we are having beta receptors, no alpha, only beta, only beta in the myocardium, the middle layer. In the myocardium, we are having beta. Which beta? We are having beta 1, not beta 2. Okay, so here we are having beta 1 receptor. You are getting my point? So beta, what does this beta 1 causes? It stimulates. So when noradrenaline will come, I deleted the diagram. So when noradrenaline will come, you can see the three layers here: tunica, endocardium, myocardium, and pericardium. So in the myocardium, we are having beta 1. So when noradrenaline come and bind with this beta 1, it will stimulate the heart. So it will increases the heart rate, it will increase the velocity of conduction, and it will increase the force of contraction. It will increase all three things. So it is causing positive inotropic, positive chromotropic, and positive dromotropic effect on the heart. So that is the thing. Okay, so that is the effect on the heart. So we have seen the blood vessel and we have seen the heart. Let's move further. In the blood vessel, we have seen it's alpha 1 and beta 2. Alpha 1, beta 2. In the heart, we have seen only beta 1. No alpha, only beta 1. Only beta 1. Coming on lung. In the lung also, we don't have alpha. We don't have alpha in the lungs. In the bronchioles, we don't have alpha. We have again beta 2. We again have here also, we are having beta 2, and that is causing bronchodilation. So this is bronchiole. This is the muscle of the bronchiole. Okay, this is the muscle, smooth muscle in the bronchiole. This is the lumen of a bronchiole. You can see this is a bronchi, bronchiole. This is the lumen and this is the muscle. In the muscle, we are having the receptor. Which receptor we are having? No alpha. We are having beta and beta 2 receptor. Beta 2 receptors are present in the bronchiole. So when noradrenaline come, bind here, it causes dilatation of the bronchiole. So it leads to bronchodilation. So it will be useful. The agonist drugs will be useful in asthma and antagonist will be contraindicated in asthma. I hope you are understanding it. So that is bronchodilation. So that is the effect on the lung we have seen. The fourth is the eyes. The fourth organ, let's talk about the eyes. In eyes, what does it causes? Let's talk about the eyes. We have seen the blood vessel. We have seen the action on the heart. We have seen the action on the bronchioles. Now let's talk about the eyes. In eyes, what does causes? They causes miosis or mydriasis. So in the eyes, alpha 1 receptors are present on dilator pupillae iris muscle. And that's why when noradrenaline will come and bind with the dilator pupillae, it will cause contraction of the dilator pupillae, and that leads to mydriasis. So alpha 1 receptor causes mydriasis, alpha 1. Okay, beta receptors are not present on iris. Beta receptors are present on ciliary muscle, and they causes when noradrenaline bind with the beta receptor on the ciliary muscle, it leads to increased aqueous secretion. Got it? More aqueous will be synthesized. More aqueous humor will be synthesized. That will increase intraocular tension. I hope you got it. Okay. So in the eye, if we talk about the eye, so this is the sclera. Let me try to draw. And this is the iris I'm drawing. And this is the ciliary muscle I'm drawing here. Okay, it's like this. Okay, this is the sclera. This is how I'm drawing. Okay, now see. This is the iris. So in the iris, we are having two type of muscle. We are having dilator pupillae and we are having constrictor pupillae. On the dilator pupillae, we are having alpha 1 receptor in the iris. We don't have beta receptor on the iris. We are having beta receptor, beta 2 receptor in the ciliary muscle, in the ciliary body. This is the lens which is connected with the ciliary body with the help of the zonules. I hope you know the basic structure of the eye. Okay, and you can appreciate this one is the pupil. So when noradrenaline is coming, what is happening? This is noradrenaline. It's coming. So it will bind here with the alpha also, with the beta also. So when the noradrenaline will come and bind with the alpha 1 receptor present in the iris, it will lead to contraction of the dilator pupillae and it will increase the size of the pupil, and that will lead to mydriasis. Because here the dilator pupillae will contract, and that will lead to mydriasis of the pupil when noradrenaline coming and binding here. So on alpha 1, via alpha 1 receptor which is present on the iris, it is leading to mydriasis. When noradrenaline bind with the beta 2 receptors present over the ciliary muscle produce more and more aqueous humor. More and more aqueous humor will be synthesized and it will be secreted over here. It will be secreted over here. So aqueous humor quantity will increase and increase IOT will be there. Intraocular tension will increase. So I hope you are getting it. Okay. So that is the effect on the eye. That is the effect. So due to the summary, due to alpha, it causes mydriasis, and due to beta, it causes increased aqueous humor secretion or synthesis, increase IOT. Coming on GIT, the next organ is GIT. The next organ is GIT. What does they do on the GIT? You can see the next organ is GIT. So in GIT, they relax the muscle, decrease peristalsis. They just relax the GIT muscle, all the muscles, intestinal muscles, stomach muscle, they just relax and they contract the sphincter. Sphincter is contracted and muscles is relaxed. So they are causing retention in the GIT. So these drugs, I mean adrenergic drugs, will cause the retention in the GIT. So in the GIT, when noradrenaline is coming and binding with the muscle and the sphincter, so on the muscle and the sphincter, on muscle we have both alpha and beta, but in sphincter we have only alpha. So you can see the muscle will relax, but the sphincter will contract. That is in GIT. The same will happen in the bladder. In the bladder also, the muscle, the detrusor will relax, but the trigone, that is sphincter, will contract. So you can see the sphincter is contracting and the detrusor is relaxing. So in GIT as well as in bladder, in both of them, the muscle is relaxing. Here also the muscle is relaxing, the sphincter is contracting. Here also the muscle is relaxing, the sphincter is contracting. So when the muscle relaxes, sphincter contract. In GIT also, in bladder also. Imagine the muscle is relaxed, but the sphincter is contracted. So there is no defecation. Here also in urinary bladder, the muscle is relaxed, the sphincter is contracted. So there is no urination. So they are causing retention here of the stools and retention here of the urine. So you can understand like this. Okay, so GIT and bladder we have seen. Now pancreas. In the pancreas, because of alpha, insulin secretion is inhibited. And because of beta, the insulin secretion is augmented. But alpha is more prominent than beta. Alpha is having more prominent action than beta. So learn insulin, overall effect is insulin inhibition. Overall effect is insulin inhibition, insulin release inhibition. So on pancreas, we are having alpha as well as beta. Okay, alpha, we are having alpha 1. Beta, we are having beta 2. Alpha 1 and beta 2 we are having. So when noradrenaline is coming, it is binding with both, here also, here also. So here, because of this combination, insulin is inhibited, insulin secretion. And because of this, insulin secretion is augmented. But dominant action is alpha 1. And that's why overall insulin synthesis, insulin secretion will be inhibited. So that is the effect on the pancreas. Now coming on the next, metabolism. In the metabolism, in the liver, muscle and fat, you can see in the liver, it is increasing the it is doing glycogenolysis and converting the glycogen into glucose, so hyperglycemia, hyperlactacidemia, and increase the fatty acids. So it is degrading everything, degrading the glucose, degrading the glycogen, degrading the lipid, degrading everything. So glucose level will rise, free fatty acid level will rise, and lactic acid level will rise. So that is the metabolism. That is the effect of these drugs on these metabolism. The next is kidney. In the kidney, you know, we are having just juxtaglomerular apparatus. So on the GJ apparatus, we are having beta 1 receptor. Beta 1 is present only at 2 places, heart and kidney, I told you. Okay, in the heart, they were stimulating the heart. In the kidney, they cause renin secretion. So whenever there is low BP, the noradrenaline is secreted, and noradrenaline secreted, it will stimulate the JJ receptor. The cells in the juxtaglomerular receptor, they are having beta 1 receptor on them. The juxtaglomerular cells is having, these cells are having beta 1 receptor on them. So when noradrenaline come and bind with these receptor, it cause the release of renin in the blood. So renin angiotensinogen pathway will be activated during hypotension. This is the mechanism. So that is the action on the kidney. That is the action on the kidney due to beta only. On the male sex organ, that is penis, we don't have beta. There is only alpha. Alpha 1 is present on the penis. On the penis blood vessel, cavernosa, alpha 1 receptors is present, and that causes ejaculation. Erection is due to parasympathetic system. Okay, and that is M3 receptors are present there. That causes erection. That is parasympathetic in nature due to acetylcholine. But ejaculation is due to sympathetic stimulation. And here alpha 1 receptors are present in penis. So in penis, the male sex organ, M3 and alpha 1 are present. The M3 causes erection when acetylcholine come and bind with M3. Okay, and alpha 1 causes ejaculation when noradrenaline come and bind with alpha 1. So here acetylcholine will come and bind with M3. Here noradrenaline will come and bind with alpha 1. This will lead to erection. This leads to ejaculation. Both are complementary during sexual activity. So I guess you got it. Erection followed by ejaculation. So here ejaculation is due to alpha 1. Beta is not present in the male sex organ. Coming on skeletal muscle, the skeletal muscle. In the skeletal muscle, beta 2 are present, and when noradrenaline come and bind with the beta 2 receptor on the skeletal muscle, it leads to tremors. It leads to tremors like this. So here tremors occur. Tremors occur due to beta alpha is not important. And in CNS, multiple receptors, I mean beta 1 are present at multiple places in the brain that leads to restlessness, apprehension, and ADS secretion from the posterior pituitary. I know this table is vast, but you have to learn it, people. There is no escape. You have to learn it. If you learn it, things will be super cool. In each organ, see the action of the alpha and beta, which alpha, which beta, that's it. Okay, I've shown you the images. Now let's start the chapter. With this orientation, let's start the chapter. I'm starting the chapter adrenergic drugs. Okay, as I told you, I teach all the chapters under a fixed set of heading. First of all, I will let you know the definition. Then I will let you know the classification, then the mechanism of action, then pharmacological action, then uses and contraindication of this chapter. Then we will come on the next chapter, anti-adrenergic drugs. So first, let's talk about the adrenergic drugs. Let me tell you the definition of adrenergic drug. What is adrenergic drug? Let me tell you the definition of adrenergic drug.
Hello everyone. I hope you found this concept clear and easy to understand. If you would like to dive deeper into this topic and master it with full-length lectures, you can subscribe my app, that is MedLive by Dr. Priyanka. So join me for the live sessions where we break down the complex topics in a way that makes them simple and high yield for exams. See you inside.